Good evening, and thank you very much all of you for being here for this YouTube live event. My name is Denis Nam. I'm an orthopedic surgeon here at Midwest Orthopedics at Rush and Rush Medical Center. I'm an associate professor of orthopedic surgery, and I'm also the medical director at Great Lakes Surgical Suites, which is a surgery center in Indiana. The purpose of tonight's talk is hopefully just to provide some information about total knee, total hip, and partial knee replacement, and also talk a little bit more about something I'm very excited about, which is robotic assisted surgery, which is a new innovation and I think really something that will advance the field of orthopedics and arthroplasty moving forward. Just briefly, a little bit about myself. So I was born and raised in the suburbs here in Chicago, spent really all of my life here before I went to college, and I went to Yale University for my undergraduate training where I was an economics major and also did my pre-medicine work there. I came back to Chicago and went to Northwestern University for my medical school training, and then I ended up back in New York City training at Hospital for Special Surgery for both my orthopedic resident and my adult reconstruction fellowship, where I feel like I received really a great experience and great training there in New York. My wife and I then initially moved to St. Louis, where I started my practice at Washington University of St. Louis, where I also obtained a Master's of Clinical Science in Investigation at that time to help with my research aspirations and also learn more about statistical methods for clinical research. I was lucky enough to come back home to Chicago, where I've spent the last 4 years practicing here at Midwest Orthopedics. It's been an incredible experience here. In terms of my practice currently, we do about 1,000 total joint replacements per year, and have an incredible team that helps guide all of our patients through their journey in their practice. Now, one of the topics that I wanted to talk about and discuss tonight, and I'm happy to answer questions about, is robotics in total joint replacement. And this is kind of a newer innovation, which I think is really going to move this field forward. And I do think that in terms of total joint replacement, we've been a little bit slower to adopt new technologies as other fields have done this, other specialties in medicine have done this. So I think to start, if we talk a little bit about what we do in knee replacement, and I can give you kind of an overview of what a knee replacement is and how we achieve that. So as most of us probably know, when we do a knee replacement, we remove the arthritis from the knee, and we do this by making precise cuts around the knee, and we try to have targets for how we make these resections. And a lot of this depends on your training and your experience, and obviously knee replacements do very well. But to give you an example of how we cut the tibia for a knee, this is an example of what a guide looks like when we do a tibial resection. And as you can see, it's really just a metal rod, and we're trying to line up this rod with your tibia. We pin this little block in place, and we'll cut freehand through this block across the knee, removing the arthritis. Now, if you can imagine, it can be kind of tough to line up this rod to your tibia because some people have a larger soft tissue envelope, and this is the assumption that your tibia is perfectly straight, which is not necessarily the case. And we cut freehand through this block, which is subject to some error. And there's a lot of investigations that show that using these types of blocks is only about 65 to 70% accurate in achieving our targets when you're using these manual techniques. Now, what robotics does is take a lot of this error out of the game. It makes it very precise and very accurate. So what I like to do, and I've started to adopt, is I obtain a CT scan of the knee before surgery. I can see each patient's anatomy in 3 dimensions. And during the procedure, I will landmark the patient's anatomy. It melds that information with the CT scan. And then we bring in a robotic assisted arm into the field that helps make the resections very accurate. And this robotic assisted arm is extremely precise. It knows whether the knee is moving in one direction or the other, and it can make the cuts very precise across the knee and achieve exactly what we want to achieve, moving that accuracy up towards 95 to 99% in achieving our targets. And the same thing can be done for the femur cuts, for aligning the components, sizing the components, rotating them. And you get all this immediate feedback during the procedure that I think makes it more accurate and allows us to achieve our targets. So robotics is something that I think is going to help move the field forward. It will certainly add the accuracy and precision to your knee replacement and your hip replacement, and I think will decrease the variability of outcomes that we can occasionally see. Now, that being said, I know that manual techniques work very well. We have very happy patients who are satisfied with these techniques. But I do think that with the information that we will gather and learn from robotics, we'll be able to use this information to improve the outcomes of patients across a broader spectrum and make sure that we decrease these outliers in patients who may not be as satisfied with their joint replacement. So with that being said, I'm going to go ahead and open up to some of these questions that we're fielding from the audience. One of the questions is, how soon can I be active after total knee with a Mako technology? And the Mako is the type of robot that I use. It's specific to our company here that we use at Rush. There are, I will say, several robotic applications in the field that are being introduced, but in my opinion, the Mako robot from Stryker has the longest track record, is the most accurate. And I think when we think about technology, usually those with longer track records are a little bit more successful because you update the software, you update and improve the performance of these things. If you think about your iPhone, you're constantly getting applications that improve over time. And that's where I think this Mako technology is. So in terms of activity after a Mako total knee, there is some early suggestion that you do have a faster recovery with that Mako knee. And the main reason being that you can decrease potentially soft tissue damage around the knee by using that robotic arm. So instead of using a freehand saw cut like you're using a manual drill at home or a manual saw at home, this robotic arm is what we call haptic guided. So when you make your cuts, it reads the bone, it reads the CT, and if you are potentially going to go outside your boundary of those cuts by 0.5 millimeters or run into the soft tissues, it stops and the saw actually turns off on its own. So it's almost a safety mechanism to make sure that you're not accidentally damaging any soft tissue around the knee, and therefore you can potentially have a faster recovery. In terms of activity, we get you walking the day of surgery right after the procedure. You will be up with physical therapy. The majority of our patients, based on their medical conditions, but if you're healthy enough, will likely go home the same day, walking with a cane, walking with minimal assistance, and doing well. So I think that patients can be very active after this type of knee replacement. So the next question is, do you use robotic techniques for both the hip and the knee? And the answer is yes. This can be done for both total hip replacement, total knee replacement, and partial knee replacement. And that's specific to the Mako technique. If you look at other robotic applications, some of them are only available for the knee, some are only available for partial knee replacements. This application can be used for all of those 3 surgical procedures. With a hip replacement, the accuracy is very high in terms of putting the acetabular component, the socket, in the exact alignment that we want. And that's another highly variable factor when we use manual techniques. It's preparing the socket by hand and then impacting the socket and lining that up. We basically use a rod to line up that socket, similar to the metal rod that we use for the tibia. Now, instead of just kind of eyeballing that alignment, with the robotic surgery, the robotic arm brings that socket into the field and puts you into a cone of alignment and makes sure that you are locked into that alignment before you impact the shell and after you impact it into place. So clearly, data will support that that is a much more accurate and precise way of putting in your acetabular component. Another question, do you use robotics for partial knee replacement? Yes, I do. And I will say that despite everything I've said about robotics, of course, total hips and total knee replacements, partial knee replacements with conventional techniques, they do very well. And please don't get me wrong, if you have a surgeon that uses manual techniques with experience, they will certainly likely do a good job, especially our partners here at Midwest Orthopedics. But with partial knee replacement, there's overwhelming data that use of robotics improves the survivorship of a partial knee replacement and improves the outcomes of partial knee replacement. I think one of the things about a partial knee replacement versus a total knee replacement is that it is very, very subject to, it's less forgiving. I'm sorry, it's a much less forgiving surgery. You have a very narrow window through you're working with. You use a very small component that if it's malpositioned can lead to earlier failure. And what robotics does is accurately align that, accurately size that, and definitely improves those outcomes. And there's a lot of registry data showing that to support that. How do I choose a surgeon? That's a great answer. I would say that's maybe a little bit like how do you choose your spouse? There's a lot of different factors that go into that. I think that in terms of choosing your surgeon, it truly is a relationship. I mean, of course, you want to see a physician and a surgeon with experience, somebody who has a good reputation, somebody who you know has committed their life to total joint replacement, to partial knee replacements, and to this field. But then you also want to meet that person. So it might look good on paper, but you want to meet them and feel like you have a good connection, a good relationship with that surgeon, and you feel like you can trust them. Because at the end of the day, it's about trusting the physician, trusting their team, and understanding that we want you to do exceptionally well and get you and guide you through this process. And I think that's what at Midwest Orthopedics, our reputation here at Rush, I think that's really what we do best, is that we have teams of physicians who have excellent support staff who will guide you through the process. And I feel 100% confident that our partners all are able to do that for you. So obviously a big topic right now, and the next question is about COVID and surgery now, and what should you do? Obviously cases now are rising. It's on everybody's concern again. I'm wondering whether we're going to get shut down from both a business standpoint, but also medical. I would say that when it comes to joint replacements, for many of us, a joint replacement is not necessarily elective. We have jobs that we want to go back to. We have quality of life that we need to get back to. And while it might fall under that umbrella for elective surgery, there's definitely cases that are more demanding. I mean, there's cases that potentially patients would want to consider waiting, which makes sense. But then there's people who really are severely debilitated, who can't walk and do their activities of daily living. Right now at Midwest Orthopedics, we've been extra careful, and from day one, we've been very conservative about the protocols we've instituted. All of our staff are now wearing masks, plus face shields. From day one, we were wearing masks, but now we are also instituting use of face shields to both protect our patients, but make sure that we are limiting and being responsible about the spread of COVID. If you are having surgery here at Rush, every single one of our patients is tested for COVID before the surgery within 3 days to ensure that they are COVID-free and not asymptomatic and positive. And we're also obviously instituting all the guidelines in terms of social distancing, making sure that we're doing vigilant hand washing. To date, knock on wood, we've been very successful about performing elective surgeries at Rush during this pandemic since, I believe, early May, with very few incidences or concerns. I think people have still been able to receive excellent quality of care despite the current environment. So do you do outpatient surgery? That's a great question. And I would say that all of our surgeons here at Midwest Orthopedics who are specializing in total joint replacement and hip and knee reconstruction, I believe we all do have an element of outpatient surgery. Outpatient surgery is definitely growing every single year. If you look at the percentages of patients who do a total knee or total hip replacement as an outpatient, that gets higher and higher. I believe the projection by 2030 is that at least 35 to 40% of total joint replacements will be done on an outpatient basis. I offer outpatient surgeries from patients having surgery here at Rush in the University Medical Center, also at the Rush Surgery Center, which is across the street, and then also at the surgery center that I participate in Northwest Indiana, of which I am the medical director. I think outpatient surgery, if you are healthy enough to undergo that procedure, is an excellent option. I do not see a reason to stay in the hospital at this point when you can go home, be in the comfort of your home, and do so safely with excellent pain control and excellent mobility. So the next question is, how do I know it's time for surgery? And again, that's a great question. The answer that I think all of us as surgeons usually tell you is that you'll just know. I think that everybody has a different threshold as for when they want to pursue a surgery. And for some people that can be, well, I can't walk 5 steps, or I can't go upstairs to go to the restroom anymore. And that's kind of an extreme scenario. But I think that now that we see that our patients are much more active, are willing or wanting to do more with their joint replacements, it might be, well, I can't play tennis anymore, or I can't go for a light jog anymore, I can't cycle. And so it's about your quality of life and what you want to get back to. So I think everybody has a different threshold. I think most importantly, if you've had trouble with your joint and you've failed conservative measures such as therapy, such as injections, medications, and you're at the point where you still don't have the quality of life that you want, I think that's a good time to consider whether or not a joint replacement is right for you. So what do you recommend if I'm not ready? So the next question is, what do you do if you're not ready for a total joint replacement? Well, I think the great thing about our practice is that we like to see patients from the beginning of their injury or beginning of their symptoms all the way to the point where they potentially will need a surgical intervention. So please reach out to our practice. Let us know. There's so many possible things that you can do, including taking some oral medications, trying physical therapy, trying a various assortment of different types of injections if you are not ready. I think there's many ways that we can attack a problem, and it doesn't necessarily mean that you have to have surgery. So we have plenty of potential non-operative sports medicine physicians here, physiatrists, who can help guide you along that process, and then eventually get to the point where potentially maybe you'll need a joint replacement. Maybe best case scenario is that you do all of these conservative modalities and you can actually put off a joint replacement and not even have to pursue that. So that's kind of what we like to do here, and manage you from start to finish. So the next question is, can I still get in to see you this year? And somebody asked, my deductible is met. So I recognize that that's always a little bit of an issue. You know, I just realized that my deductible for getting potential contacts this year is full, so I should be able to fulfill that. My wife keeps bugging me to go do that. So in terms of meeting your development, yes, you know, we are available to be seen here. My practice still does have some availability for new patient appointments, I do believe, during the rest of the year. I think we may even still have some surgical appointments. Of course, my team is the boss, and they kind of run that aspect for me, but please reach out. Certainly, if you come and call our office and my office and we do not have the availability that you're looking for, I have complete faith in my partners. Also, we will always have, we want to take care of you from our standpoint. If it's whether one of my partners reaches out to you and meets you also from that standpoint, I think we'd be more than happy and willing to do that and make sure that you get taken care of. So I think that's about it. I think that's all the questions that we have. I appreciate your attention. I appreciate the time that you've taken to spend with us tonight. If you have any questions at all, please reach out. Please call our practice. My practice's number is 312-432-2340. I also do have a website. It's drdenisnam.com. That's one N in Dennis, drdenisnam.com. But also you can reach any of our physician providers here at Midwest Orthopedics at Rush at 877-MD-BONES. And we look forward to answering any questions that you have in the future. Thank you very much for your time.